If you or someone you love has heart disease, it's important to know where to turn for information and quality care. And joining us right now is cardiologist Dr. Jonathan Buggey from Summa Health. Doctor, thank you so much for being here. Let's start with asking the question, what exactly is heart failure? What to look out for? Maybe a common sign or a symptom that it's coming?
Yeah, no, I appreciate it. And thanks for having me. So, the interesting thing about heart failure as a diagnosis is it's really a syndrome, which means it's a collection of signs, symptoms, and unlike a lot of diagnoses that you might get from the doctor, which might just be based on one lab value, like anemia, it's a low blood count, it's a little more complex. So, the broad definition is it's when anybody's heart is failing to pump blood forward to meet their body's needs. And so this can result from a number of different things, and it can cause a lot of different signs and symptoms. Commonly, people come to us complaining of shortness of breath, a lot of fatigue. Patients will even start to develop leg swelling, fluid accumulation. And when things really get severe, they can even have issues like passing out or end up hospitalized, of course.
Let's ask this question then, as far as treatments for patients with heart failure. What do you subscribe or prescribe?
Yeah. So first and foremost, we always want to try to identify what is the driver. So is there a cause? And if there is one or multiple causes, can we reverse that cause? Some examples of this would be if somebody had an arrhythmia, an abnormal heart rhythm, could we treat that and get their heart back on track, so to speak? If they have blocked heart arteries, can we fix those? If they have a nutritional deficiency, can we fix that? In the end, after we try to identify those causes, reverse them if we can, we also, in certain populations, so patients with weakened heart muscles, so the heart's not squeezing out blood or pumping out blood as much as it should, we have a number of different medications that we prescribe to patients. We also have some occasional procedures, cardiac devices like pacemakers, defibrillators. And when patients' care gets really advanced, we start talking about whether or not they would really benefit from a permanent or temporary implantable heart pump, or even consideration of things like heart transplant.
You mentioned advanced care. What makes Summa Health an excellent destination in our region for someone dealing with heart failure?
Well, I think first and foremost, I would say we have everything that a patient really needs for their heart failure care here at Summa, short of cardiac transplantation. We're able to make the diagnosis. We have advanced imaging techniques. We have the doctors who are trained specifically in this disease, such as myself, to prescribe the medications, follow patients over time. We can provide different cardiac surgeries and implant different devices through the various subspecialties of cardiology as well as cardiac surgery. And we have a lot of other supporting members outside of cardiology that help with our patients because they often have other medical problems.
Let's talk about a takeaway for this little conversation we're having here. What do you recommend that someone watching right now know about heart failure or cardiology, the program at Summa Health that's waiting for them?
Yeah, absolutely. I would say first and foremost, come to us as early as possible. If you think you have congestive heart failure, talk to your doctor. And if your doctor thinks they need help and wants to get you in with us, please come see us. We'd rather see you sooner than later.
Great advice. For more information to reach out to Summa, all you have to do is call 877-200-0209 or log on to the website, summahealth.org/heart. Doctor, thank you so much.
No, thank you. Appreciate it.
This segment of Good Company was sponsored by Summa Health.